Hello and welcome to Health Professional Radio. I'm Patrick Reyes, and on today's show we are joined by Gerald Quigley. Now, he is a community pharmacist and medical herbalist with skills in the integration of complementary medicines with prescribed medicines. He is also a regular columnist in Retail Pharmacy magazine and contributor to a wide variety of health and pharmacy publications. Welcome to the show, Gerald.
Thank you, Patrick.
Now, tell the audience at home what it is that you do.
I'm a pharmacist, as you mentioned. I do a lot of things. I'm a qualification of a master herbalist, so I have a medical herbal practice where there I really practice as an integrative herbalist. So my patients tend to arrive with a bag of drugs and a bag of supplements, and they say, what in heaven's name is going on with all of these things? I lecture third year Bachelor of in the Southern School of Natural Therapies in Melbourne, and I teach third year naturopaths, nutritionists, and therapists in a subject called Drug and Integrative Pharmacology, where we give them an elementary understanding of the role of drug treatments in a person's health, bearing in mind that there's upsides and there's sometimes downsides. So we teach complementary medicine therapists how to do that.
All right. Now, on the topic of cholesterol, when I think of cholesterol, all I think of is like fatty food or food that's high in saturated fats. I know there are good cholesterol, but most people seem to worry about having high cholesterol. What might be some of the effects for having high cholesterol?
Well, essentially, Patrick, what high cholesterol levels do is elevate your risk for cardiovascular disease. But remember, in thinking about cholesterol in food, about 60% of the cholesterol in our body is made in our liver. So our liver has a very important function in helping produce cholesterol, a fair bit of which is used in producing bile acids, which help us digest fat. But cholesterol is an essential substance in our body. We need cholesterol. Cholesterol exists in every cell in our body, and sometimes, for various reasons, the adverse publicity about perceived high cholesterol levels takes away the benefit that cholesterol offers to every single one of us. So, for example, cholesterol prevents the walls of each cell from collapsing into a blubbery heap. So it's essential for cell structure. Our cells are designed with lipid rafts, and cholesterol plays a role in there. It helps our brain function. It repairs damaged arteries, helps our skin. So it's all about balance with cholesterol, Patrick. And this attack and this fight that we seem to be constantly reminded we have to keep our cholesterol levels low can sometimes distract us from the fact that it's all about balance, the balance between the so-called good and the so-called bad.
Oh, what are some of the main differences between good and bad cholesterol?
Well, bearing in mind that we seem to think that good cholesterol is protective, and we seem to think that the bad or LDL cholesterol, that's called LDL means low lipoprotein cholesterol, the difference seems to be that the focus is really on managing that LDL. It's oxidized LDL, which appears to be causing a lot of the issues that we're concerned about. And oxidation is just like aging. So when our skin ages, we get wrinkles. When LDL cholesterol is oxidized, it does potentially cause some damage. So the tendency these days in both drug treatment and in complementary medicine treatment and in nutritional treatment is to manage that so-called bad cholesterol and keep the so-called good cholesterol at decent levels. Bearing in mind as well, Patrick, that it's the particle size of the cholesterol that also plays a role. The total cholesterol that we get quoted constantly in our blood levels is only part of the picture. We need to look at the levels and the ratios of the levels, and anything we can do to maintain lower levels of the so-called bad or LDL cholesterol is certainly worth considering.
And what are some ways that people can manage their cholesterol levels?
From a nutrition perspective, we look at omega-3 fatty acids, things like krill, We look at legumes and beans and nuts and oats and avocado and olive oil. There's lots of different things. But an interesting nutrient which has arrived is actually from Cuba, and it's a sugarcane wax alcohol, which in clinical trials, and we had an expert from Cuba here recently lecturing to a huge conference, in clinical trials, what this substance does, this sugarcane wax alcohol, and it's been given the name polycosanol, what it does is help control some of the oxidation of that bad cholesterol, of that so-called LDL cholesterol. And that's very important because then it protects all of our blood vessels. It helps us with cholesterol because that's probably our topic today. But it actually helps the health of all of our blood vessels right across the board, particularly the main ones. But every single tube which contains our blood, in fact, gets some measure of protection.
Now, some of the effects of having high cholesterol can lead to atherosclerosis. Can you tell us what atherosclerosis is?
This is essentially damage to the blood vessel walls. It's a plaque accumulation, Patrick, which means that we get so-called clogging, the common term clogging of the arteries. We really need to keep these pathways of our bloodstream in top shape. We do that with exercise, essentially. We do it with looking at some proper nutritional suggestions like stopping smoking and reducing alcohol intake. And you mentioned fatty foods at the start of our chat. Fatty food every now and again is okay, but it's how we deal with the fatty food that's very important. And that cholesterol plays a role there because it helps us produce bile salts. So atherosclerosis is really, that's the issue. That's the vascular health issue that confronts a lot of us as we age. And that's another challenge today, Patrick, that we are living to a longer age, to an older age. So we want to live as well as we possibly can, quality of life as good as it possibly can, with as few interventions as possible. And that might mean we take probably more responsibility for our own health than just going to the system and hoping we can correct the problem which has occurred.
Now, which would you say is better for atherosclerosis? Would it be prevention or treatment?
Prevention is the way of the future, Patrick. If we know some of the causes of atherosclerosis, and that usually is lifestyle related, and we tend to blame genetics sometimes. It's good to blame the relatives if that's possible, but they can't take the blame for everything. If we can maintain the health of our capillaries and we can maintain circulation to peripheral areas of our body, particularly our brain and our eyes and legs, hands and feet, then we're on the way to a quality of life improvement that we can treasure for the rest of our days. And we're talking, a lot of this doesn't happen overnight, Patrick. This takes many years to develop. So these interventions we talk about, we've got to start educating folk that it's time to take some responsibility. Far, far easier to reduce the risk of a problem developing than throw the kitchen cabinet at it once it's there, and then we never get things back to normal.
Now, is there a way to increase healthy cholesterol naturally?
I mentioned some of the food groups before, and remember, it's balance. It's all about ratios of the total cholesterol to your good cholesterol. The triglycerides we haven't mentioned, but they can be a problem with fat in our bloodstream as well. Exercise, absolutely important. Proper food choices, and when you mention to folk about proper food choices, we all know what they are. We just don't elect to take them if we get a choice sometimes. We look at the easy option of usually high carb and high salt. So those sorts of things, but it's all about balance. If we can keep the ratios between the HDL or good cholesterol, and the focus these days tends to be on the low-density lipoprotein or LDL, and stop it from being oxidized with any number of the nutritional inputs I've mentioned, as well as the sugarcane wax alcohol, then all of those things mean that we keep the pipes nice and clean. We reduce the risk of damage being done, and if damage is done, it is repaired efficiently.
Now, before we go ahead and end the segment right here, what's the biggest misconception that the public has had about cholesterol?
I think the biggest misconception, Patrick, is this focus on the total, this total number. And you can see people's eyes glaze over when they appear and they say, my cholesterol is X, and now I've got to go on to other options. What we have to do is point out, as we mentioned earlier, the importance of having healthy cholesterol levels, of moving away from this focus on the total and having some idea of where our HDL good and LDL bad levels lie. And from that, we can see the changes as we improve our lifestyle, we get more exercise, we perhaps lose some weight, we move away from high carbs and move on to better protein and better fats, healthy fats, and you can see the changes. Now, the change of the total number, which is the focus, is quite slow. But if we can shift the ratios up and down and make those ratios healthier, everybody feels as if they're a little bit involved. It's almost empowering our patients to take some responsibility for themselves, and that, in the long term, makes a difference.
All right, well, it's been a pleasure talking to you today, Gerald.
My pleasure, Patrick. Thank you for the chat.
Thank you. Now, you've been listening to Health Professional Radio. I'm your host, Patrick Reyes, and we've been in conversation with Gerald Quigley as we talked about the good and bad cholesterol and effects high cholesterol could lead to if it's not managed correctly. If you've missed our conversation or if you'd like to listen to this interview again, transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.